So, a sandwich usually means, well, something you eat, two pieces of bread with some kind of filling in the middle. But back in 1981, it actually became the name of a generation. At first, it described a group of middle-aged folks, young baby boomers to be specific, who found themselves as caregivers, kind of sandwiched between their young kids and their aging parents. These days, boomers might find themselves sandwiched between their grandchildren, their own children, their parents, and sometimes, even their grandparents. And honestly, sometimes the boomers themselves might need caregivers too. The Centers for Disease Control and Prevention reported that baby boomers most often cared for a parent or parent-in-law, about 42% of the time. Besides all the physical, emotional, and mental challenges that come with caregiving, there are, honestly, a lot of Medicare concerns that need to be addressed. In my experience, those things often get lost in the shuffle. But when a health crisis hits, not having sorted out those Medicare issues can really make things even tougher. It's never too late to get ready. This checklist will help you fill in the gaps, just in case. And if you're a boomer, it might be a good idea to do this for yourself, as another just in case. Because Medicare encompasses so many Social Security issues and vice versa, let's start with that. A My Social Security account is a secure online portal that allows individuals to manage their Social Security benefits and information, request a replacement card, update contact information and direct deposit, and, well, a lot more. If there is no account in place, your parent should establish one, so start here. If there is an account, verify that access to it is through either a login.gov or id.me account. Social Security has really been ramping up security protocols, so just the username and password will no longer work. If there is no account in place, your parent should establish one. If there is an account, verify that access to it is through either a login.gov or id.me account. Social Security has been ramping up security protocols, so just the username and password will no longer work. A Social Security representative payee. If you must talk with Social Security on your parents' behalf, you really need to be a representative payee. A power of attorney document just won't work. If there is no representative payee in place, your parent, if still in charge of affairs, can do an advance designation, listing one or two trusted individuals who can manage the benefits. If and when someone else needs to take over, Social Security will choose one from the list. If your parent is not able to make those decisions, a visit to Social Security will be necessary to go through the application and vetting process. Medicare. There's no need for information about your parents' health and medical coverage when they are healthy and managing on their own, but when a medical crisis is wreaking havoc, you'll need that information, so you might as well get it now. Cards for Medicare and additional Medicare coverage. If your parent has Medicare Advantage with drug coverage included, there's only one insurance card that has the words Medicare Advantage on it. If opting for original Medicare, your parent would have a Medicare card, the red, white, and blue one, and probably a card for a Part D drug plan and Medicare supplement plan, also called a Medigap policy. The Medicare Advantage and Part D drug plan card should be for the current year. Even though plans may not change, insurers issue new cards in the fall. So let's talk about a Medicare authorized representative. Just like with Social Security, you actually need more than just a power of attorney to communicate with Medicare. You have to be a Medicare representative in order to speak with Medicare and handle things like claims, appeals, and grievances. To do this, you'll need to fill out a specific form and submit it directly to Medicare. Now, when it comes to speaking with a Medicare Advantage or drug plan representative about something like a billing or coverage issue, you might need to complete a form for that particular plan. It's not always automatic, so just be aware that sometimes an extra step is required. Let's talk a bit about paying those premiums. Medicare Part B, which is your medical insurance, Medicare supplement plans, some Medicare Advantage plans, and most Part D drug plans all come with monthly premiums. If you don't pay these, the coverage can actually be canceled. And once that happens, there's often a delay before you can get your coverage back in place. With Part B and Part D coverage, whether it's a standalone plan or part of an Advantage plan, there can even be lifelong penalties if you let it lapse. And if your Medicare supplement gets canceled, you might have to go through medical underwriting to get your coverage reinstated. So, yeah, it's really important to stay on top of those payments. Here are a few things to know about payment for each type of coverage. For Part B, if your parent is receiving Social Security benefits, the Part B premium is actually deducted automatically. Now, if they're not yet receiving those benefits, Medicare Easy Pay is an option. Medicare will automatically deduct the premiums from a checking or savings account. When it comes to Medicare Advantage and Part D plans, it's also possible to have premiums for Part D drugs and Medicare Advantage plans deducted from the Social Security benefits. You'll need to work that out directly with the plan. If that's not an option, you can always set up auto payment with the plan. For Medicare supplement plans, there's no option for deducting these premiums from Social Security. The next best thing is to arrange for automatic deductions from a checking or savings account. As you may have noticed, the safest solution is to set up everything on auto pay. So, one client I worked with, well, he just didn't trust auto pay, so he decided to send his payments through the US mail instead. The next time I actually heard from him, it was about 2 years later, and unfortunately, his Part B had been canceled because he hadn't paid the premiums. He really wasn't sure exactly what had happened. There are some important questions you should ask. For example, where does your parent keep important papers like insurance policies or trust documents? Now, you don't need to go through these documents if your parent is still independent, but it really helps just to know where they are. I remember before my father went in for major surgery, he showed me his hiding spot up in the basement ceiling. Honestly, I kind of suspect that as soon as he was back home, he probably moved them. Another thing to consider, do you have a current list of doctors, healthcare facilities, and medications? If there's ever a hospitalization, this information is going to be really important. Does your parent open any mail from Social Security, Medicare, or Medicare plans? Some days it seems as though the mailbox is filled with only junk mail. However, it's important to dig through that for any important mailings. I have heard from children of retirees who learned that their parents' retiree coverage was changed to a Medicare Advantage plan when they started getting bills from their doctors, who were suddenly out of network. Every January, I get calls from those who did not pay attention during open enrollment. Their premiums skyrocketed, or an expensive drug was no longer covered. Is your parent prepared to handle long-term care costs? Someone turning age 65 today has almost a 70% chance of needing long-term care services and support in their remaining years. Over half of middle-income baby boomers believe that Medicare will pay for their ongoing long-term care, so they believe they're covered. If you don't know whether your parent have planned for these costs, this could fall on you. The average annual amount caregivers spend out of pocket on caregiving is $7,242. Plus, all the hours of caregiving provided by family members is worth $204,000. Maybe it's time to have a conversation. I know from experience that this is not easy, but you can get through this with a plan. Arrange the steps in a logical order and check them off. Then, you will be prepared for whatever lies ahead.